women consider the pill as the ultimate symbol of the feminine movement. It stands for the reproductive freedom, equality, and choices, and women's rights overall. And well, I'm a pro of all of those things, a true advocate. The pill stands for me is something entirely different. And it's not great. I'm Martin Benjamin, certified master herbalist, functional nutritionist, with almost 20 years of experience in women's reproductive wellness. Welcome back to the A to Z of fibroids, where I break complex topics down in a way that actually makes sense. Today, I'm going to discuss the pill and other hormonal contraceptives, including the complication the pill can cause, not only with the reproductive system, but also other body systems. Despite how it's prescribed, hormonal contraceptions, and I say HC moving forward, right, doesn't regulate your menstrual cycle. It regulates bleeding you experience while you're on the HC, and it's not actually your period. Let me tell you what's going on. These methods, which contain synthetic version of estrogen and progestin, they can also significantly impact your fibroids, leading to their growth, increasing in size, and often worsening your symptoms. So, how does HC work? All HC prevents pregnancy by suppressing the three following things, okay? Normal ovarian. So, how does HC work? All HC prevents pregnancy by suppressing the following three actions: a normal ovarian function, normal endometrium development, development of fertile quality cervical mucus. HC suppress normal ovarian function. The hypothalamus, pituitary, and ovaries, connectively known as the HPO axis, must communicate for ovulation and a normal menstrual cycle to occur. The HC effectively prevents pregnancy by disrupting this process. They contain synthetic estrogen and progestin, which inhibits the gonadotropin release hormone from the pituitary gland and the hypothalamus. This reduction in hormone signaling stops your follicular development and prevent the LH surge that is needed for ovulation. So in other words, most HC stop you from ovulating. The other HC suppressing normal endometrium development. Pregnancy can only occur when the endometrium lining of the uterus is fully developed. There is a brief window during the menstrual cycle when the endometrium is ready for implantation. And in a normal cycle, estrogen promotes the growth of the uterine lining before ovulation, while progesterone supports its thickening after ovulation. So HC can disrupt this by producing or suppressing the natural hormone production and expose the endometrium to synthetic hormones. The third one. When HC doesn't completely suppress ovulation, it still protects by preventing the production of the fertile quality of cervical mucus. The HC stimulates development of the thick, impenetrable cervical mucus that fills your cervical canal and physically prevents sperm from reaching your uterine cavity. Now let's talk about the common side effects associated with HC. They fall into four major categories: nutrient metabolism challenges, mental and sexual health issues, thyroid disorder and blood clots, cancer and other health conditions. It is well known that HC alters a variety of metabolic processes that can affect nutrient absorption and metabolism. HC lowers your serum levels, a number of key nutrients, including the B vitamins like B6, B9, B12, folic acid, vitamin C, vitamin E, and CoQ10. It also disrupts mineral metabolism, for example, such as zinc, magnesium, and selenium, just to name a few. HC also causes depression and other mood and emotional changes like anxiety, panic attacks. Has also been shown to lower free testosterone by an average of 61%. Although women produce 10 to 20 times less testosterone than men, women still depend on it to maintain a healthy sexual and reproductive function. Prolonged exposure to this synthetic estrogen, NHC, has been shown to alter thyroid function for the duration of use. HC is known to increase the serum binding compatibility of the protein responsible for transporting thyroid hormone into the bloodstream. Listen, HC, and this is where we get a little serious here now, right? HC is also associated with additional serious risks like thrombosis, right? The formation of blood clots in blood vessels. And that can lead to pulmonary embolism, a blockage in the lungs, or ischemic, a stroke, which is blockage in the brain. HC can increase the risk of thrombosis by 3 to 20 times due to the increase of blood coagulation, raising the chance of these life-threatening conditions. So by now, I know many of you are wondering, well, what is the safe alternative? Or is there an alternative? Is there something out there? Because I don't want to get pregnant. Chill, relax. Let's talk about non-hormonal birth control options. And they often are presented in a negative light because they are not considered as effective as hormonal methods for preventing pregnancy. The 5 most common non-hormonal birth control methods are fertility awareness-based method, condoms, withdrawal, diaphragm, and cervical cap. So the fertility awareness-based methods are birth control methods that rely on your menstrual cycle chart to help you identify the most fertile days of your menstrual cycle. And the most common fertility awareness-based method is called the symptothermal method. And then you have the condom. To maximize the effectiveness, you want to make sure that you choose the right size in the condom. Check the expiration date, make sure it's put on correctly, and only choose condom-friendly water-based lubricants. Withdrawal. This will require you to depend entirely on how well your partner knows his body and if his withdrawal game is A1. Mine's ain't. I got 5 children to prove it. It wasn't. But I don't really promote this method, but it is listed, and for that reason, I have to mention it. Then we move on to the diaphragm and the cervical cap. The diaphragm is a thin dome-shaped device that is placed into the vagina to prevent pregnancy by physically blocking sperm. The flexible rim of the diaphragm fits behind the pubic bone, where it completely covers the cervix. The cervical cap is a small cup-like device that is designed to be placed directly on the cervix. But unlike the diaphragm, which is held in place due to its placement behind the pubic bone, the cervical cap maintains its position via suction or adherence directly to the cervix. Both the cervical cap and the diaphragm are designed to be used with spermicide, and both remain in place for 6 to 8 hours after having sex. So look, this is what I want to tell you. I have a live, I'm finishing the video a little different today. I have a live at 8 o'clock Eastern Standard Time on Instagram, and I have also another live tomorrow, 7 p.m. Eastern Standard Time on TikTok. So please join it to ask questions or even more questions about the things I've been covering, from oxidative stress to hormone imbalance, to blood sugar levels, to vitamins, minerals, nutrition, you name it. Fibroids, you can ask it. So you know my motto, right? Save this, share it, and follow me for more A to Z of fibroids.